As scientists, NGOs and policymakers gather in Durban at the 11th South Africa AIDS Conference, there are concerns about the widening inequality gap. Scientists have also raised alarm bells about the increase in HIV infections in the country. There's a call for some targeted interventions to also be directed towards young people. Let's reflect on this now and more. Professor Salim Abdool Karim from the Center for the AIDS Program of Research in South Africa. He's the director there, joins us live now. Prof, thank you so much for your time this afternoon. SANAC saying that South Africa records over 1,300 new HIV infections per week, and this is in the 15 and 24 age group. We also learned from one of the NGOs yesterday that some young people don't want to use condoms. There's clearly something we seem to not be doing right here.
Good evening to all of your viewers. So we really are in a situation where we've got to turn this around. What we were seeing over the last decade is a steady decline in the number of HIV cases, but that decline has slowed and over the last 3 to 4 years has stalled. So the decline is no longer continuing despite our increases in treatment. So that means we've got to do more in prevention, whether that's through condoms or whether that's through PrEP. We've got to be able to reach certain groups. And the number one highest priority is to reach out to young women, particularly those between the ages of around 15 to 24. In that group, we still continue to see incredibly high rates of HIV. And it's a real challenge for us to reach that group and to provide them with technologies that they can use and control to reduce their risk of HIV.
And Prof, what's behind that, you think? Is it a case of, challenges with accessing, the facilities, or is there a disinterest on their part?
The real problem is that young people don't really think about their risk. They don't go about their daily activities, I might get HIV today. They also are free-spirited. And they are the ones that challenge the norms, whether it's wearing seatbelts or taking risks when they cross the road. So young people are risk takers fundamentally. So as part of that, they are not thinking about that risk. And if you're not thinking about it, then you won't take measures to avoid that risk. And that's our big problem. The similar issues relate to their access to medical care and medical services. Young people don't very often go to the healthcare service, and so they don't really access testing services and so on. So it's a combination of all of these things. But principally, our target has to be that if we're going to reduce HIV in this continent, we've got to reduce HIV in young women. And many of them are having sex with men who are on average about 8 to 10 years older. So it's that age disparate sex that we also need to be reducing.
And I wonder, Prof, also another thing that, a lot of people are talking about as well is just how much of a setback was also caused by the COVID-19 pandemic, especially when it comes to the widening of the gap as well when it comes to treatment.
So it was a setback that we witnessed back in 2020 during the stage 5 and stage 4 lockdown. There were fewer people going into the healthcare services for testing, for treatment, and so on. So we've seen that. Much of that has now been overcome. So we've been able to deal with that backlog to some extent. And so, but the problem was not that we weren't able to deal with the backlog. The problem was that it slowed down our rate of progress, and that's what we can't recover. So we've lost, in a way, that 2 years and a bit, and now we have to make that catch up and get back on track in terms of reducing the number of new infections.
And how do we begin to even catch up, Prof? Because 2 years is a long time. And you look at the fact that, when you look at the UNAIDS global report, it talks about of the 38 million people living with HIV globally, South Africa remains the epicenter, around 8 million people living with the virus. And so, of course, their stats in 2022. So how then do we begin to claw back and really catch up on this lost time?
So we've got to do two things. The first is that we've got to increase the proportion of people who know that they are infected. So that's the you might have heard of the United Nations 90-90-90 strategy, that 90% of people who have HIV should know their status, and 90% of those should be on treatment, and 90% of those should have a suppressed virus. That remains our target. So that target, we were supposed to meet it in 2020, but the world missed that target. There were a few countries that did meet the target. Botswana is an example of a country that did, but South Africa as a whole did not meet that target. So now we've got to postpone that target and say, let's aim for that target by 2024. The second thing we need to do is we've got to develop new technologies to enable young women to protect themselves. And that means, trying to find new ways to get daily tablets to them or injectables to them. So that must be our dual focus: treatment and upscaling it and implementing and getting it out there, and offering young girls the opportunity to protect themselves.
And these young girls, Prof, I wonder how much of an issue is, stigma when it comes to some of them choosing not to go to healthcare facilities, choosing not to take treatment, because they're certainly probably coming from, communities where they would be frowned upon if they did this.
Unfortunately, HIV is not simply just a medical condition. HIV fundamentally is a social challenge, and it involves a large amount of stigma and discrimination, whether it's against people who have the disease or whether it's amongst those who are at risk or trying to take prevention strategies. So we've had to deal with this problem right since the beginning of this pandemic. It's eased somewhat, but there are still elements of stigma that serve as an obstacle to people wanting to know their status. People think, why would I want to know when I stay if all that's going to lead to is I want to get stigmatized. So what we have to do is we have to fight that. And fighting stigma, fighting discrimination is as important as getting treatment to people who have this disease.
And definitely, Prof, and also just community education, just to arm a lot more people with information. Thank you so much for your time. And as you say, this is a fight that, we really have to continue as a country to fight. We cannot afford to give up. Thank you so much for that. That's Professor Salim Abdool Karim, Center for the AIDS Program of Research in South Africa Director. Let's take a short break. When we come back, we have more news of the day for you, but also a concerning story around teenage pregnancy. You may have seen some of the stats.